Hello, I'm John. I am retired from the aerospace industry. I have done extensive work in satellite and guidance systems. I came here to see Dr. Gulani from Southern California, and I did it because I did my research and I found he was my best choice. I've had a number of eye surgeries before. I've had RK in both eyes. I've had PRK multiple times in one eye. I've had a PTK recently in one eye. And these surgeons who performed those operations were well-known surgeons in Southern California, very, very good surgeons. I then got to the point where my age and probably the fact that I was becoming somewhat cataractous made my vision need more attention. Unfortunately, everyone that I asked said, "No, you've had RK, that really limits choices. This is not good." I did my research online. I did my research by reading technical articles. I found Dr. Gulani here in Jacksonville. That's why I came here to see him. He is a surgeon who does not say, well, this had occurred in the past, so you can't do that in the future. He looks at the eye, your eye, as a problem that needs to be solved. There are a lot of aspects to it. He examines them all. Then he comes up with the custom medical procedure to give you the best vision that is possible. That's what he did for me. I'm just 48 hours, less than 48 hours actually, out of surgery by Dr. Gulani. I had no difficulty during the surgery at all. My vision is becoming clearer every day and every hour. I'll be getting on an airplane to go back to Southern California where I live just about 24 hours from now. I'll fly across country. I have no reason not to be able to live my life the way it should be lived. Dr. Gulani answered every question that I had. He then told me more information that at the time I wasn't smart enough to ask about. I now know much more about what it was he was doing than what I would have known beforehand. And he did everything that he intended to do, and I am extremely, extremely happy. I would come back to see Dr. Gulani anytime, and specifically, I very likely will be coming back to have him take care of my right eye.
John, what a pleasure to see you here today. We just did your surgery less than 48 hours ago, and you're ready to travel back to California.
I am very much ready to travel back to California, Dr. Gulani. And by the way, may I say, I am glad that I can say it's good to see you, because vision was my issue with you.
Sure. And to answer your question, John, you had asked me what was challenging about you. Not only the fact that you had RK and you had over 16 cuts in each eye, the fact that you then had 3 laser procedures, 3 PRKs, all with very excellent surgeons in California, and then you had another PTK for a scar on the eye.
Yes.
That's what makes your surgery very complex for many reasons. One is anatomically, I have to enter this eye, and my desire is I don't want to take a stitch because stitch induces astigmatism. And my entire drive is how do you get the best vision no matter how complex the situation is. So to answer your question in one sentence, it's my attitude also that makes my work difficult, because I want every drop of vision you have, despite the complexity. And that's important as I teach surgeons, that do not give up just because things are complex, people have had many surgeries, or you feel that the chances of success are low. Fight for every drop you can with the least intervention. So your surgery became complex or difficult because of your multiple RKs, your scar in the cornea, multiple laser surgeries, which decreases the predictability of the lens power. So physically my challenge is how do I get in and see during surgery, and mathematically how do I know where I'm landing with all this stuff. But everything's gone very well, and during surgery we expect all the other issues, and they all happened with you, is you are a very high myopic eye, so your chamber became very deep, your iris started closing in, but and your cataract was very hard too. That's why in RK patients I recommend early cataract removal, but waiting till beyond 70 years of age, cataract gets hard too. So addition, all these things when you compound, it makes the case a little more complex than a routine cataract surgery. But I still believe the attitude of wanting to make you see makes it even more complex, because Now you're predicting to a low predictability scenario. Does that make sense?
Oh, it absolutely does. In retrospect, had I known many of the things that you've educated me on earlier in my life, you'd have seen me earlier. But I didn't know. And none of the other professionals that I saw, for instance, gave me the point of view that those who have had RK and then have cataracts and don't have those looked at until they are in their 70s present an additional unnecessary complication. If I had known that, I would have done things different in the past. I would have sought you out. I would have found out what it is that you do. But now that I know that I will be telling my contemporaries, and by the way, I've already told one that I've met here in Jacksonville who's actually in his early 50s, that he, who is highly myopic, I said, I have learned from my surgeon, do not think that cataracts are something that you worry about when you're in your 70s and your vision is going dim. See a professional before then, and it may pay off. Dr. Gulani, one of the most fascinating parts, amazing parts of my interaction with you in this last week is that you, a world-renowned eye surgeon, has given so much time to me, one patient. You have many, many patients. And I have found the fact that you will devote that much time to one patient for something that to the patient is of paramount importance is excellent. My experience with surgeons in the past has been not that they are dismissive of the patient, but their time is very limited. They can spend only so much time and I have to go see another patient. You're not that way at all.
Again, to me, John, this is a passion. As you saw with all the patients today who come fly here with so much trust, many of them have had multiple surgeries like you had. Like in your case, you had RK, then you had not only RK but 16 cut RK, you had 3 PRKs, 1 PTK, all with excellent surgeons in California.
Yes.
And then you had cataract, which is much more dense because of your age. All these things together make it complex, but my point is, just like you said, but that vision is so important to you. You cannot be treated as a number. Your desire to see has to be my paramount responsibility. So the time that I spend, it's a privilege. I mean, what I get to do, sitting down with you. I mean, look at you. You're an accomplished aerospace scientist. There's just a discussion we've had. I've learned so much from you. I may know a lot about eye surgery, but I'm humbled by your knowledge. And it's a privilege for me sitting down with y'all. Y'all fly with so much trust with me. And then I have to perform. Yes, it's difficult. But what I teach eye surgeons is that difficulty lowers down because you feel for the patient. You can't just show up and just operate on eyeball number 20. You know this is John. You know this man is banking on you for his vision no matter how complex. Now you have to perform. So that performance requires planning, measuring, remeasuring how many times I saw you before surgery. So to me, John, I still round this with, it's a privilege to get to do what I do.
I can certainly understand that you would think it's a privilege. People like me are very lucky that you take it as a passion as opposed to a way to gain prestige, make money, etc., etc. One of the things that I have found singular about our interaction is since you are obviously you're a world-renowned eye surgeon. I am an astronautical engineer and retired military officer and have been around technology all my life. It turns out in our case we have a common language, which is optics. You can use terms and I can use terms in our conversations and we know what the other one is saying. I have, as you know, I was very interested in everything that you were thinking about doing and how you would do it. And I think I'm able to understand a modicum of what it is that you describe. You mentioned trust. You expressed to me when I first was speaking with you that you treat the patients as though they were your family members. And I will tell you that the impression that I've gotten is you operate on a patient's eyes, my eye in this case, as though it were your own eye. And I can't think of a higher compliment than that. I put all my trust in you because once the anesthesia is in effect, I have committed, and you are going to do what you're going to do, and then we will both see just how well it came out. Here we are, 44 hours or so post-op, in a very challenging cataract and related surgery, and I am seeing very much better now after 2 days, much better than yesterday, and I've noticed even this morning things are getting clearer. I could not be happier, except could I turn the clock back to before I had RK? I would do that, because since I had RK, I couldn't have PRK. I mean, not PRK, I could not have LASIK. That was better technology, but I took what was available to me when I was highly myopic. In the mid-80s, I had been all my adult life. I took what there was. It was better than what I had had before. My vision was improved, and then as new ones came along, others were improved. It's only in retrospect one can see, if this had been available then, or that, then you would have made these choices. But I came to you as a patient who had made his choices. And what you did was look at my eye and say, this is what I can do to give you the best vision that you can have.
Absolutely, and like I said, to me, it doesn't matter how many surgeries you've had. If you have the potential, the surgeon has to fight to get you there. John, it's been a privilege, and have a safe travel back to California. It's been an honor.
My pleasure, sir. I appreciate it very much.
Great.